I know you've worked in oncology for quite some time. What are some of the misconceptions that South Africans have when it comes to cancer?
I think that one of the commonest and the saddest misconceptions is that they will not be cured. Because people have seen something that's happened to a neighbour and then they have a misunderstanding that the disease is the same. And I think it's extremely important that people understand that if they're diagnosed with a cancer, there's every good probability that they will be cured. And if they stick with their treatment regimen and can attend for their appointments, then the chances are extremely good that things are going to work out well for them. And a lot of the other misconceptions are around the side effects that we've already discussed. That people think radiation is a burn when it's not at all. And I think a lot of fear. People are very fearful of the types of treatment that we give, that they're going to be very, very ill, that their hair is going to fall out. But again, with modern equipment, modern chemotherapy and modern supported drugs to try and reduce the symptoms, many, many patients get through with very few side effects.
Now, you often hear that radiotherapy will make the patient more ill than the cancer itself, but I imagine that that isn't true.
It's definitely not the case.
Now, I want to speak to you about doctors in general. There was just a survey released and it found that South African doctors were less optimistic about the healthcare system than last year. Is this something that you're seeing in your day-to-day work?
I think it's difficult to say year by year how people in general are feeling. I think that when people talk about optimism, I think they're actually translating how stressed they feel in providing the services. And I think that the Public Health Service in South Africa does a fantastic job considering the resource limitations that they labour under. And I think that the reality is a lot of doctors suffer from a lot of stress. And I think there's a fair amount of burnout. Whether that translates into people being optimistic about their healthcare services or not. From my point of view as an oncologist here in the Western Cape, I think we provide a fantastic service to the public health sector, and I'm really proud to be part of it, and I think we're just improving. So I feel quite the opposite myself for cancer services, particularly in our province, that I think we're just getting better and better as the years go by.
Now, how do we alleviate that burnout you were speaking about?
For medical staff?
Yeah.
That's difficult. I suppose it's part of working environment and how to try and improve people's working environment as much as possible. And that comes a lot from support from management, knowing that people are appreciated at work. A lot of doctors stay in the public health services because they're very interested in research. Many of us are associated with universities, such as ourselves with the University of Stellenbosch. And if you have access to research and you can go forward with developing new ideas and new projects, I think that also helps people feel that their job is a bit more worthwhile.
Does the public health sector need more resources?
That's the reality of any public system of any kind, is that we're not a private sector. We are managed with government funds and government resources, and we carry the biggest burden of health disease in the country. About 80% of the whole population will need public health care over private. So, of course, we unfortunately don't have everything that we need. But once again, in oncology, I think we're pretty lucky here in the Western Cape that we're well resourced for the patients that we have.